I guess I own it now. Okay. Well, welcome back, everybody. This is Kelly Singh with Athena Health. And we're going to walk through a new patient registration and scheduling of a patient. So I'm going to kind of just pretend that I'm playing the role of the registration staff at PCHC. I pick up the phone and I have Kelly Singh on the phone line, who is looking to schedule an appointment with a family medicine practitioner. So the first thing that I'm going to do is go ahead, and that box is there so you can't see it, but nothing super unique. Is I'm going to search for the patient. Athena is going to provide you all a plethora of ways to search. So you can search by name, date of birth, you can search by a custom ID, so you all can actually import your legacy Athena practice number into Athena and search by that. You can search by phone number, etc. For today, I'm just going to go ahead and I'm going to search by last name only. And you can see that no search results have been returned. If I did, maybe I'll do like a little bit of a more open generic so you can kind of see the results, what it looks like when it brings it up. If this was, for example, I was searching by Smith, I could add additional filters to help narrow down the search. So the goal here is to help you quickly locate the patient account, thereby preventing duplication counts.
Kelly, quick question. Does it show active and inactive in your search, or do you have to click a button?
Yes, so it will not show, so you have the ability to mark patients as inactive. When I go to their quick viewer chart, I would get alerted that this is an inactive patient. You don't see it from here, but once I click on either quick viewer chart, it would tell me. And I do also have the ability to just quickly pull up a synopsis, and it would tell me right here that the patient is inactive as well. But it's still going to come up in the search so that somebody doesn't accidentally think this is a new patient, and then it turns out it's a duplicate patient.
Great, thank you.
You're welcome. So I confirm Kelly's, she's from Florida, she's brand new, so we're going to go ahead and register her. Now, when it comes to the registration process, you can see it brings over my search criteria, so I don't have to worry about that. And you also notice that there are some yellow fields. So these are required fields. So in order to successfully register this patient, I have to complete these fields. This is 100% dictated by PCHC. So this is a great way to create standardization among your new patient registration staff members. At a very minimum, you have to have the last name and the first name, but then everything else from there is customizable. So for Athena, for the demo purposes, we just have the minimum necessary. Now, as I'm entering in these fields, the system's doing an auto duplication check route. So if one of these fields started matching another patient, like my phone number, my address, or maybe my first name and date of birth match another patient, or last name and date of birth match another patient, I get a little pop-up that says possible duplicates. And then I could go directly to that chart. Or if it's not a duplicate, we confirm this is a new patient, then I can exit out and continue with my registration.
Quick question, Kelly, before you go on.
Sure.
In that box you were just in that section, the
yes.
patient information, I see legal sex, but I don't see that birth sex.
That is, yes.
Identify, what you identify, gender.
So,
what you identify.
yes, we can gather that. It's not at the time of registration, but we do have the ability to gather that once we create the
Okay.
account.
All right.
Yes. You're welcome. And then I'm going to go ahead and just enter the patient's phone number. We would recommend, so best practice, some of the fields that we would recommend that you all get is, for example, patient email, because that is the way to log in and create a portal account. Also, too, once we schedule the appointment, within 2 hours, they'll get an email confirming the appointment has been scheduled, and then a link to have them sign up for the portal if they have yet. So ideally, we would advise for you to get that, but if you don't want to, you don't have to. And I apologize, I didn't realize we'd be doing an RCM kind of practice management. You would also have your social determinant of health fields here as well, if you wanted to capture it at the point of registration. So income, veteran status, homeless status, all of those, you could capture that here. I just don't have that setting turned on. This is where, you also can capture it here. Sorry, it was just down a little farther.
Oh,
So this is where you could capture the gender
Excellent.
identity,
Sexual
assign
orientation.
sex at birth, pronouns, etc.
Perfect.
If you all do want to add custom fields, you can add those and make those required as well at registration. And then any other field. So if you don't know at the time what provider they're going to go with, you can just select anybody right here. It's not a big deal. It doesn't really affect anything in the long run. It's just kind of a caveat. And then I can enter, of course, their emergency contact, next of kin, employment, guardian, and then the guarantor. So it's assuming, because I'm a little over 40, so obviously it's not my real birthday, but that I'm probably my self-guarantor. However, anybody that's pediatric, it automatically requires this as a required field because it's assuming a 9-year-old is not going to be their own guarantor. They could be, but at this point, Athena, so we, because we have the visibility and transparency into all of our 167,000 providers on the network, we have created a lot of best practices. And one of those best practices is that at the point of registration, if the patient has their insurance card available, to go ahead and add it. Obviously, sometimes that's not always the case because they could be driving, so we could go ahead and just directly schedule that patient. So I'll ask you all, do you want to go add insurance? Do you want to go scheduling?
Can we save and add insurance to
Yeah.
see that part? Thank you.
You're welcome. So this is if I don't have an image. So like I'm registering the patient over the phone. So during the self check-in, the patients can take a picture of their insurance and then the system will surface the correct plan. Also too, when they come into the office, they can give your staff their card. You all can scan it or take a picture with Athena Capture, and then the system will automatically select the package. So this is purely if I don't have the card with me. So you do all have the ability to set your most used standard policies. So instead of always having to search for the package, I can quickly go. This is also a great way to indicate which payers are in network versus out of network with you all. But if it's not down here, you can see that I can just go ahead and just quickly search for the insurance name. So I'm going to go ahead and do Cigna because I know Cigna's number. So Athena automatically knows like the formatting for each ID number. So if I incorrectly type it or if I have too many letters versus numbers, the system will tell you, hey, are you sure you typed this in correctly? Because this is not matching Cigna's format or Medicaid's format, etc. We also maintain all the insurances for you. So it's a global library that's being used across the country with all of our 167,000 providers on the network. So you don't have to worry about maintaining this. You can add custom ones because sometimes you have like local contracts and stuff like that. But as for like the major,
So would you do that for like a works comp case?
we actually have workers' comp too already. But if it was like one that's local to you all that nobody else has ever brought, you would just request it. So you would give us the information that's needed. You would obviously be able to create it right then and there on the fly. We would then verify that the information you had entered is correct or that it's not a duplicate for one that's already been created. And then we would actually add it to the global library so that other main institutions that are on the network could benefit from selecting that package.
Is that like that Christian Care that you see on TV now? Like a Christian Care network where you can.
Yeah, where those patients, they pool their money together to help pay, like they have private insurance. So instead of paying, a premium to Aetna, I pay a premium to this and then that's what pays. And it's cheaper and
Now, what about if a payer, I noticed that when you search, it's, it doesn't have the full address, it's just the city and state.
yep, and that's, I'll tell you why.
Okay, great.
So because when it comes to searching for insurances, this is probably the most complicated part. Like, I don't even know what my Meritain specific plan is, like, or where it's supposed to be billed to. I just know I have Meritain and this is my ID number. So that's all.
Smallest font in America when you look at your card. It is
Yeah.
literally, it's like one font.
Yeah, so all we're expecting from your patients who are more than likely not just laypersons who don't have much medical knowledge is you just capture the insurance name and get the member ID. At this point, we are now directly communicating with payer, in this instance Cigna, to pull the correct package. And so Athena is bringing a list of the Cigna matches with the one that it's pretty confident that it is at the top. And so I can go ahead, I can then select it. I can enter any additional information if the patient has it and wants to give it to me. Otherwise, at this point, I can go ahead and perform an eligibility check. So this is why we recommend at the point of registration, getting the insurance, because the eligibility check runs this quickly. Remember, the UI has changed from this. This is the old UI, I just don't have it updated in the sales demo. But the information that's conveyed to you is the same. So I would know right here if the patient's ineligible. So before we hang up the phone, I could say, hey, that came back as ineligible. Did you recently change a insurance package, etc.? Because you're never going to get a hold of the patient after you schedule until they come into the office. Also, too, it would show you coordination of benefit issues. So this would say something to the effect like, patient is on Cigna's file, however, it looks like they have another primary payer. So then you could say, hey, do you have somebody else other than Cigna? And they would be like, oh yeah, I have Medicare. We could get that. Also, it would tell you if you did accidentally select the wrong plan. So it would say, hey, patient is on Cigna's file. You selected a PPO plan, but it's showing they have an HMO.
What if, say, the date of birth was not a?
We also show you that. So we don't have any discrepancies here, but if there was demographic discrepancies, we would show it so that you can update only on the claims, the demographics that match what is on file with payer. So that way then, I mean, they don't normally deny it, but technically if they wanted to, they could deny it saying we can't find that patient.
Yeah.
But so it just updates it on the claims that are going out, but still keeps it, because it's,
Keeps the integrity in the chart
Right.
because your formatting is different than what the payer
Because
needs.
it's my responsibility, which actually it's really, because I have employer-based health, I have to have Athena contact Meritain to change my date of birth. Do you think I'm ever gonna do that? No. Like, let's be real. Unless I get like a huge $6,000 bill, I ain't doing that.
Yeah.
And then of course you get the benefit detail information. Again, keep in mind, this is just all in it's a more user-friendly UI.
Does it also tell you if there could be another plan attached to that patient somewhere else with another payer?
The coordination of benefits, like the
That's
primary,
what it
yes,
would.
yes.
So
it
not
would.
just within their own, like you've got the wrong section.
No, but yeah,
of
they would
Cigna.
also, it would not tell you, and now it unfortunately isn't smart enough to say, they also have Medicare. It'll just say,
Really?
hey, there's another,
Okay.
there's another plan that's involved here. So you at least know to start probing and asking them questions versus, it would be nice if we could, but the payers, we're taking what the payers give us, and let's be real, they don't wanna pay. They don't wanna play nice. So, So now at this point, so we've got her fully registered. Let's go ahead and schedule her. So I'm gonna schedule. And so this is our new schedule view. It is more mirroring Outlook, so we are having some updates to this. So right now you don't have the ability to drop and drag, but that is on the roadmap for scheduling and stuff like that. But what you have over here is you have the ability to select saved views. So for example, I could do, as a female, maybe I prefer female internal medicine providers. You could create a saved view that just shows all of the female internal medicine providers at location A. Or, if you have a location that has multiple specialties, you could narrow it down to be like, these are, pediatrics, or this is where behavioral health, like, these are our behavioral health specialists who do adolescents. These are our behavioral health specialists that do adults. So it helps narrow down the filter. You can see here, I have the calendar, so it's showing me the days. Green indicates we have availability. It's defaults to this week, but I could go forward in time. I could go back, or I could quickly just use this one over here. I do have the ability to narrow it down, so I can narrow it by department, provider, or specialty. And then I can also look at day, week, work week, so maybe if you guys only are open Monday through Thursday, and then also just first availability.
So availability would be your next
Available,
open.
so it depending on, so it'd be like, if I don't have a saved view, it would just be at this location that I'm looking, so at our internal med location, what provider has the next available? It doesn't look as good with you, cause we have, everybody has availability, so it's like,
no.
cause this is fake. But, okay, so I'm gonna go ahead, let's schedule a doctor with Dr. Medina, so I select the time, I'm gonna go ahead and book the appointment. It pulls in my information, my insurance, lets me know that I am eligible there. It does pull in the appointment. Now, you all determine the appointment type, so the actual schedule templates are built and maintained by you. The only caveat is appointment types have to be built on a 5-minute increment. So 5, 10, 15, 20, 25, 30, 35, 45, 55. You can't be like dermatology who wants to see a patient every 2 minutes. So you can't have like a 2-minute appointment, 4-minute appointment, never had a complaint with that at all, but just wanted to let you know. And so because, so you have the ability to make it a specific, or in this case, it's a generic template, where essentially any spot is available, and then I can, at the point of scheduling, narrow down which appointment type we're scheduling. And again, the appointment types are customizable by you all.
If it was a templated or a specific appointment type within that time frame, and you wanted to override that, is that possible?
You could, yes. You also can give the ability to double book, that's a permission. So if somebody needs to double book, even though you've only slotted one and somebody's already taken that slot.
What about
That would be right.
2 columns for one provider, say like the Cairo, they have a double schedule. Actually, most of our providers now have a second column where there's like what we call a trifecta, where in an hour period, there are 3 30-minute slots, but they're offset, so one is.
Oh, yeah, that would show right here. So it's again how you create it.
Okay.
Yeah, how
And
you
is that
drop
built
and
in
drag
there
the templates, yeah.
Okay.
Again, just the appointment time has to be on a 5-minute increment.
Yeah.
So we couldn't have this 8 a.m., 15-minute, and then you have any 2-minute appointment.
Yeah. No, that won't.
If any authorizations were required, I could see that here. Can enter some additional information about the appointment, or I can just go ahead and then enter the notes, new patient, schedule my annual exam.
I do like that patient's condition related to employment, other party.
Yeah.
Yes, that's very nice.
And then from here, I could also add another appointment. So say she's also like on a roll and she's like, I don't know, I wanna make next year's annual wellness, we could go ahead and do that.
Or lab prior to
Yep, or a
this.
lab prior to this.
A lot of times we book our pharmacists seeing patients, they're seeing the patient doing some training, and then they book the same patient on the provider because then the
Collaborative
provider has
visit.
kind
Yeah,
of
so
a
you can
collab.
see, so then you can see availability same day, same week between
Can you
those.
link those 2 appointments? We have the ability
Yes.
to link
If it's the same day,
same
you
day.
can link them, so then I get only one appointment reminder, which is for the first appointment. And then when you check me in for the first appointment, it checks me in for the second one. So yeah, you can link them, or you could keep them separate. You don't have to link them
Yep.
either if you don't want it to.
What if a patient had another appointment the same day with a different provider? Does that show you somewhere, like,
Yeah,
or?
Didn't it show at
it-
the top? I think I saw somewhere.
It shows you somewhere, I don't know if we passed it already,
I
but it
saw
does
that
tell you
earlier.
if you have
Correct.
any
Yes.
appointments
Yes.
already.
Because you have to watch that
Yes,
certain type
yes.
as an employee.
And it does alert you, so like if I already have an appointment on this day and I'm trying to schedule this new appointment, it would alert me when I try to confirm, like review, it's gonna say, hey, you already have another appointment with so-and-so, are you sure you wanna schedule this?
Perfect.
Okay, great.
Yeah. And also I could do reoccurring, so this will be great for your behavioral health. So like I just wanna come in every Tuesday at 9 a.m. It will schedule all of that with one click, you just enter the end date.
If there was a conflict.
It would show you, so once I hit schedule, it will then show me the dates where there is a conflict, and then there would be a link for me to go in and schedule, instead of I can't do 9 a.m., there's a 10 a.m. on that day, so I can put that one off on that one. So now
I'm loving it.
we're gonna go ahead and review, so yeah, you can see right here, scheduled appointments, so it's gonna show you any other scheduled appointments that you have.
Yep.
And now we can go ahead and book that, oh my mouth, I can't look up there because it's a delayed
Join
weird.
me with me, bro.
And now I have booked this appointment.
Oh, God, thank you.
Kelly, you want anything before we send it out?
Oh, no, I'm good, thank you, I've already eaten a whole sandwich, so. And then, I have the ability to print it for the patient, but again, remember, they're gonna get all those notifications, it's going to the portal, stuff like that. You also don't have to, here's additional filters too, where you can narrow down, so you can narrow down by sex, provider type, or specialty, as well as the specific, and then you can also create non-providers, like a lab or
Yeah, we have a
a
lot of
X-ray
those.
or something like that. Yeah, so you could do that as well. The other thing that's new with our scheduling, is, sorry, that's in the way. You no longer have to go directly to the patient. So before you had to go to the patient to schedule, now you could actually just go to the calendar. And then when you select a slot, you can go ahead and then search for the patient and then add their information.
Perfect.
And
I
you,
actually like it, I like that better.
I always feel, I worked in I worked at an orthopedic sportsman's, so I always asked who the patient was first, like I never just went to the calendar. I would always go and then schedule, but when I was a project manager, I have been on site, and even when demoing still, well, we just wanna see what's the next available, like, we don't wanna look at the
I can
patient.
see where a lot of our staff will say that, they'll
Yeah.
still want that
Yeah,
ability.
so you have both options. And then two, from the calendar, I can go ahead and I can reschedule, I can cancel, I could actually freeze. So maybe the doctor comes in and says, hey, we have an emergency meeting, I can go ahead and quickly freeze those slots for on the fly on the calendar.
Is that set at a permission level?
Yes, yeah,
Perfect.
all of that's permission based.
Can you put a reason for the freeze, once you freeze it? or is
Yes.
it- Okay,
Yep, and those are customizable by you all.
okay.
Yeah.
Now, is that how you would also, because I see the reasons there. We have some providers who every week they have a meeting at the same time, and we build that into the template.
Oh, yeah, you would
before we
include
write it.
that in
Okay.
your template build.
Okay.
You could do those appointment blocks.
For the recurring.
Yeah, and then you don't have to worry about it. This is more like on the fly, like,
Yeah,
yeah,
which is what we do now, we just block it.
yeah, exactly.
Now, at this time too, once you book it or prior to hitting that confirm button, does it do the eligibility check and all that for you also?
So it does
this way?
not do the eligibility checking at the time of scheduling. It's not, you can go ahead and run it, but it's not a link that when I schedule, it's also running eligibility. But remember, if we are gonna be running eligibility as an appointment, so if this is like a same day appointment, I would quickly just perform a
Yeah.
on-demand eligibility check. Otherwise, if you're scheduling out a few days in advance, the system's gonna run it and schedule it.
Now, what about for walk-in? Because we have a lot of walk-in patients who are in our system, they're not seen here regularly, but they're supposed to be. But still. We would open the charter schedule.
Yeah, so
I'm
you
thinking
could,
the workflow we'd have to
you
run it.
They could go right to registration and run the eligibility and then schedule the patient?
so, so if they're already scheduled, so let's just say, so I'm gonna I'll search for Kelly Singh, so it comes up. I could just quickly go down here, see her insurance, hit the perform eligibility. It will come up for you. That's the demographic discrepancy example. Run it, it's coming back, okay, it's eligible. All right, so then let's go ahead and create a walk-in appointment.
I like that.
Yeah.
And keep in mind, as you notice, I have multiple tabs open. And then here's like a possible duplicate match, obviously that's incorrect. I think the computer is confused, or sales demo's confused because but you can have multiple tabs, so you could technically have the patient's insurance open on this page, and then, go ahead and schedule that walk-in appointment as well. So, And you can see it does give you a nice synopsis right here of provider availability as well.
That's great. I like the look a lot better than the old version.
Oh,
What-
way.
Oh my
Why
Way
is,
better.
why is the green circle up by your name in the banner?
So that's because I don't have a picture there, and
Oh,
so
okay.
we picked a gender neutral color. It used to be, we had like a head,
Oh, yeah, it was just
shadow.
a shadow.
yeah, but that's not,
Silhouette.
what if, you know, if you're legal,
Oh,
you're born male, but now you identify as a female, the headshot is showing, and if a patient sees that. So we just went with green.
Yeah.
Everybody is just green if we don't have a picture, and there you go.
Green is money.
I like
So,
it.
I mean, I'm sure,
Yeah.
exactly. I'm sure there's a patient that's gonna complain, I don't like the green color, but you know, whatever.
Whatever. Give me a picture.
Yeah, exactly. So that's why it's green. Any other questions on registration and scheduling?
Yes, so
Should I
the
keep
appointment.
recording this, or do we wanna stop for
No, I
Q&A?
think some folks
Okay,
would want
Okay,
to
okay,
know some of this stuff. The reminders, tell us about the reminders, when do they go out, is it customizable,
Yep.
what's sent?
So if you get the patient's email at the time of new patient registration, within 2 hours of scheduling that appointment, they will get a confirmation email letting them know that that appointment's been successfully scheduled. Also too, anytime you schedule an appointment, they will get an email thereafter, within 2 hours, letting them know that appointment's been successfully scheduled. And then we will do the appointment reminders. You set up the cadence. Best practice we have found is 3 days in advance. However, you all can adjust that all the way up from, I believe it's 14 days all the way to same day. And you can have multiple reminders. So you could have a 14-day reminder, a 7-day reminder, 3-day, and a 1-day. That's customizable. But the appointment reminders go out via text, email, and phone call. The text and email have links to confirm the appointment, to cancel the appointment, or to reschedule if you have enabled self-scheduling. And then they will also get a separate reminder to do the self-check-in if you have enabled it for that appointment type. And again, the self-check-in can occur between 14 days or the day before the appointment, whatever your preference is to set up. Best practice is 7 days within the 7-day window. The phone the phone notification, on the other hand, it gives me the option to, I don't know if this is exactly right, but I think it's press 1 to confirm, press 2 to reschedule if you have live operators, which then, or it would transfer to your all's call center, whatever you're using, to reschedule the appointment, or 3 to cancel the appointment. And then if I press, so with the text message and the email, it will also already include the instructions after I confirm the appointment. But if I confirm the appointment on the phone, then it provides me the instructions for that appointment type, such as, you know, this is your annual wellness, please do not eat or drink anything after midnight. Whatever, it's customizable by you.
Do we record those messages or do you, or are
It's
they
text
all-
to speech, so you just type in the text and then excuse me, there's a lot of carbonation going on here. And then a female robot dictates
So
the
they're-
information.
Not
We
warm and
use-
fuzzy, it's a little.
We used to actually have one person up here somewhere in Maine that recorded all of our appointment reminders. And I think it just got, now that we're such a large,
Yeah,
it's just not feasible. And I can't imagine how much it costs then to pay somebody to
yeah.
personally
That might
record.
have been my sister, she used to do that for the company she works.
Oh, really? Yeah, it could have been. So now it's just everything is speech to text. So like, you could do text messages in French as long as you have somebody who can type French. That, now the robot can't speak French to the patient. The robots can do Spanish and English, but the robot can't do any other form. But if you have somebody who can write in French, you guys could create a text message or an email in French for your patients. Just keep in mind the text message does have the SMS character limitation, which is standard across the board. That's
Yeah.
not unique to Athena.
Quick question, does the confirmation statuses show on the schedule that the patient confirmed,
Yeah, so really the schedule that I would recommend for best practice to be looking at is the eligibility and phone list. And so then you can see over here in the appointment confirmation results, so I could just toggle to the different day. It always defaults to today. And then I can see if they've started self-check-in. Unfortunately, we don't really do appointment reminders in sales demo. But if this was a live environment, it would say confirmed, it would say reschedule, and then what date they had rescheduled to, it would say canceled if they canceled. Also too, if it was a phone call, it would say left voicemail, or it would say contacted, which indicates that the patient did pick up the phone but then hung up within the first 5 seconds. And then also it would say notified, which indicates that the patient listened to the entire phone message but never then entered a response to confirm, cancel, or reschedule.
But on the schedule itself, does it show confirmed?
No, not at that
The
point.
status of the appointment doesn't change?
Correct.
It's quick and easy to get there.
That's great feedback that we can take back.
Well, I think we do a lot of, there's some reporting and some things that we look at around different statuses of appointments.
But you could get that
But you're gonna
because
get
it's
that,
there.
you're just not gonna
Right,
get it
it's
from
just
that
not-
home schedule.
Right,
It's just in a different
way to
Yeah,
find
and you'll be able to report on all of it as well.
A couple other questions that popped into my head. I'm assuming, I shouldn't assume, but patients have the ability obviously to unsubscribe from email or opt
Yes.
out of texting.
Yes, yes,
Do we have the ability to opt them back in if they
Yes.
call and say, you know,
both, yeah, so it's, I can do it via I do have to have a portal. Except for the text messages, I can obviously respond stop, and it opts me out. But yes, I can log into my portal, dictate my contact preferences, and then you also can control the patient's contact preferences if they are there with you.
Okay. Oh, it'll come back.
Anything else, should we?
What about a patient who might need an interpreter?
Yes, so let me first ask you how you currently handle that.
Well, different ways. So
Okay.
if it's self-scheduled, there is a question during the process, do you need an interpreter? And that populates into the request, and then the staff call and arrange that.
Okay,
Otherwise, it's on the phone or through text, and because of an alert we may have.
Mhm.
And it's just a pop-up, I think, still, isn't it,
Yes.
Taylor? So it's just a pop-up.
Okay.
Chart, this patient needs a ASL interpreter or Spanish interpreter or
Mhm.
whatever.
so the ways that our current clients do it is one, create a chart alert.
Yeah,
But there's also where you have the ability to indicate the patient's language. And so, for example, it's very important for those Spanish patients to indicate that their language is Spanish so that so all of our patient-facing tools are in Spanish. So that makes sure that the system will know when it sends out an appointment reminder, it needs to be in Spanish. And so obviously none of our other ones have any other languages. So really you don't have to use this field. Like, so if I did put French here, unfortunately, unless you all run a report for your French speaking patients and then send them that specific campaign. So those would be the two places. And then for telehealth, if you are doing a telehealth session with an interpreter, our telehealth allows up to an unlimited number of participants. So you can have the provider, the interpreter, and the patient, and the patient's guardian at another location, all join that telehealth session.
Two other questions I just remembered. One, in the reminder that goes out to the patient, does it specify the appointment type?
No, not unless you wanted to.
Okay,
That's a
yeah.
setting you configure.
Great.
Yes.
Second question, does it send out a notice to patients who may no-show, either by email or text?
Yes, so at the end of the day, you can mark all your patients who are no-showed. And then what it does is it triggers a campaign to those patients, email, text, or phone call, depending on their contact preferences that are set, letting them know that they missed an appointment. And if you enable self-scheduling, then they have the option to self-schedule with the live operator or through the online scheduling tools. So that's an automated process.
And the online scheduling, is that only through the portal or is there a link for?
Yeah, so you could
non-portal
actually,
users?
sorry that this is in the way. So what you all could actually do is you could have a link that says schedule an appointment now. And so I don't have to log into the portal. You can limit it to existing or you could allow new patients. And then you would indicate, I'd indicate what specialty. And then you would add the reasons that patients can schedule. So this is customizable by you. So I'm gonna go ahead and let's just say it's a sick visit. Now, the only thing here is at this point, it's showing me all the providers who have self-scheduling enabled at the specific specialty. Also, there would be a location for you to pick, and I can also select in person or narrow it down to provider. But it doesn't recognize who my care team is. So if you want to limit self-scheduling to my care team only, that can be done through the portal. But at this point, the system doesn't know who I am. And so it's opening it. This is really great for sick visits because it's like for internal and pediatrics or family med, because it's like I don't care who I see unless you all want to keep on with it.
Yeah, we do.
Okay, yeah. So here I can go ahead, I can select, obviously this is customized by you, so you're not doing a 115. Obviously you don't have a smoke test provider, but you get the point. Then what I do is I quickly enter in this demographic information. The system's doing a check in the background. So if I'm an established patient, it's gonna merge this into my account. If I'm a new patient, it's gonna actually create me a mini account. There's a dashboard that you all can monitor to see patients who have basically self-registered themselves this way so that you can contact them, get additional information. And then I can go ahead and indicate that I have yes, I can enter my information and insurance information right here for you, and then I can go ahead next and schedule that appointment.
So is there a way to add I know you've got all these fields that are required to really hopefully prove
Do
that
the-
patient.
right,
But
do
is
the-
there two-factor authentication also? We have some situations like peds where dad can't schedule for
Not at this point, no. So that's why, so maybe you don't wanna do the self-scheduling outside of the portal. So like, I know my pediatrics office, you have to go through the app or the portal in order to schedule. They don't have, and that may be the exact reason why they do that.
But this would be great for our walk-ins, right? If we wanted to open up our website for a walk-in and just have 6 visits
Yeah,
that people can schedule
Yeah.
their walk-in visit.
yes, absolutely.
flu clinic.
So you could, yeah, so like you could on your webpage somehow put, like walk-in
Schedule your
clinic,
walk-in
yeah,
visit,
schedule,
right?
yeah, make it very clear. And technically could dad still schedule the pediatric visit under your walk-in clinic? Yes, but we, that's just, obviously no vendor can help with that. It's just making sure you all have the policies in place and that you set up the parameters. So like, you double check that if it is a pediatric coming in, that the parent is the guardian that's listed, or, or like, we had one practice when I was doing onboarding. He told me that he would have patients that he didn't allow he only allowed basically annual wellnesses. And so what they would do is they would just select annual wellness and then use it as like a sick visit or something if they could. And he was like, if I found out, our staff's practice was to tell the patient, we're not seeing you today, we will reschedule. And then the patients got the point, don't look through workarounds to get around the system.
Wow.
I don't know if you guys can do that, but
Yeah.
that's what, he was a private practice, so. But yeah, so you could have both those options. And then 2, also doing through the app and the portal also allows you to limit it only to the care team members. Versus this is more of a
Wide open.
whoever is allowing for self-scheduling walk-ins. And then for your walk-in too, you can also technically just do you could do a non-provider schedule. So that way then, I don't know if you have multiple physicians are working or if you don't know who's gonna be covering the walk-in clinic that day. When you check in the patient, you can just quickly select who's gonna be the rendering provider. So, instead of like the nurse schedule, you could just then quickly, okay, so, Dr. Dessner is the one that's covering.
That's the current workflow, it's
Yeah.
put on a generic
Yeah.
walk-in, and then once
Yeah.
it's known which provider
Yeah.
it is.
We also have a walk-in schedule too. It's more for urgent cares, but depending on how your walk-in clinic, it could work. So I'm actually gonna go ahead and view it by status. So this changes the layout of that home schedule. And then instead, now I can see who's scheduled, who's in the waiting room, who's with staff, who's with the provider. If anybody did, if I had generated any orders for William, it would show it right there that we have a test result that's ordered, or we have results that are pending or results that are received. So it's great to allow me as the provider to quickly figure out whose room I need to go to. So I could say, oh, William still has pending results. I'm not gonna go, let me go to another patient. And then it also shows you how long they've been waiting. So yeah, this is, and then also too, as the MA, I can quickly see which rooms are available to room patients in versus rooms that are unavailable. So that's another view that's really helpful for the walk-in, like urgent care clinics.
Love that. What about, say, tomorrow we have a full schedule and we get a blizzard? Is there an automatic way to cancel or notify our patients that we're
Yep, so this would be an admin permission, and so I'm gonna actually go to schedule. You could do this from home, so you don't have to get out in the blizzard and jeopardize your safety. And then I'm gonna go ahead and I'm going to manage appointments. I'm just gonna select the appointments that are applicable, and then from here, check them all. And then down here, I'm gonna go ahead and we're gonna send out the immediate cancellation due to inclement weather. You can have multiple ones, or you could just do immediate cancellation, which is generic and it's not due to weather, or the weather one. And then within 20 minutes of me hitting that button, patients are gonna start receiving text, email, and a phone call, letting them know that the appointment's been canceled due to inclement weather.
Love
You
it.
like that, Taylor?
It's a lot easier than our current process, isn't it?
And then of course, if you allow them to self-schedule, they can actually, from the text and email, go ahead and just reschedule that appointment themselves. Depending on what time the message is sent out, so remember live operators only working from 10 a.m. So obviously they won't be able to reschedule with a live operator until later, unless you send it out. But with the phone call, at least.
I mean, that would be great when we know we close, we're gonna,
Yeah.
open late the next morning because of the snowstorm.
Yeah, you could create a campaign like that says, we are gonna have a delayed opening tomorrow. Yep, you could do that. The only thing you can't use the campaigns for is marketing purposes, because the federal government doesn't allow us to use it. So we do monitor it. It does have to somehow be related to patient healthcare. You can't be like, hey, we created a new lotion.
Yeah.
Come and buy it. We will send you a nice email that says, please stop.
Speaking of which, all the spam laws, which is perhaps one of them, has started getting certain things shut down for us. Patients will complain, I'm not receiving, messages or whatever. You guys are taking care of all that in the background. We don't have to deal with that on our own phone numbers.
That's correct. So there are you do have to, the required fields, you can't change it. So like you have to get verbal consent to text message the patient. So that's a required field that you all cannot register the patient without selecting that. That's because of that lawsuit about sending text messages. I think I got 87 cents from Walgreens because they were sending out text messages. Yep, I'm super rich. I was like, oh, I should retire now. Those group call campaigns, we run reports. Actually, one of my providers got in trouble because he used to send out things like, hey, I'm doing a speech at Emory University. And then he no longer does it anymore. So we're monitoring
So you're on top of
it.
that, so you keep us from.
Because we're gonna get in trouble too.
Right,
Right.
and we're gonna get blocked, so.
Right.
Yeah.
Well, I don't know, do you have, independent numbers that identify us as us?
So when you set it up, you have the ability to show what number reflects in the caller ID. So you could use your practice number. If you don't select a number, what it does is, and this is why I know this, because my OB just has a generic number, but I have a Kansas cell phone. So anytime my OB sends me a phone call, it comes in as a 316. So it matches your area code, so it doesn't look like a spam
Got it.
number. It's not like a 888
Or we
or,
could use our own.
but you could use your
One of
own.
the things I've got like, I think it's my orthopedist that looks like a dentist, and it's like super annoying. I'm going, do I
Yeah.
answer this? Do I not answer this?
Yeah,
What about the ability for us to see the message that goes out to the patient? We've had reports like, well, the message said that my appointment was at 10:30 when it really was 9:30 or a different day. Can we see the actual message that was sent?
yeah. So unfortunately, because I don't really have, we're not in a real environment. But I can go ahead and see all of the call activity that's happened. So it shows what message went out. It shows how long the patient was on the phone. It shows the text message that went out.
Similar to what you showed before, like if
Yeah,
you're
very
on for
automated,
5
yeah.
seconds and hung up.
Yeah,
Actually,
okay,
the detail of the text.
Very automated for that patient. There's also a patient communication activity that you can run more at a higher level. Again, I don't know, because we're in a demo environment, so
That's okay, just
And we
knowing
can-
it's.
yeah, you have all of that, yeah.
It really is Big Brother.
Oh, super big brother, super big brother.
It's great.
Yeah, which is
It's great,
super
Yeah.
helpful.
great,
Yes.
great.
So-
It
Great.
really is.
Yep, so here you go. So I can pull up exactly what was sent to the patient right
Oh, I love
there.
it.
So, yeah, you can see how it was delivered.
Nice.
Can it tell us for email if they've read it, if they've opened it?
That's a great question. It does not look like they can. Cause you can see it only has the link for the phone calls. So we do not have the read back
Yeah, just
capabilities. Yeah. Any other questions? We're still recording, so just whenever we're done recording, we can stop.
Ann, do you have any questions?
Am I muted or not? Am I not muted?
Now we can hear you.
Oh, okay, perfect. I don't know if I had missed if it got covered in another session or whatever. I was just curious about integrations with lab software like LabDeck or Nordex and stuff. How that works.
Yeah, that's part of the standard use case scenarios that we have, and I know Sue and Emily had an inventory list of all of the connections that we would need to do. But LabDAC is something that's a national partner of ours that we have.
Okay, perfect.
So that would be included.
Yeah, there's no additional.
Because I know I kind of joined right as you were finishing up talking about Qvera. I know we use Qvera for quite a bit of integrations with LabDeck, Nordex, Dow Chase up here in Bangor, and a few other places. So I just was curious if that was just going to completely go away, or if we would still need to hold on to it for some some interface.
Yeah, the Qvera piece completely goes away. We as Athena One don't have any relationship or candidly any need for
Okay.
Qvera. And I hate to say it, but Link Logic is going to go away too. I know it's going to make you really sad. You know,
So upset about that.
we'll give it its proper burial.
one of
So
those-
yeah, I think that the nice part is, Dan, is that if we have existing integrations, like if we have anybody that's down the street that uses Athena that has connections to, whether it's lab or imaging facilities, then we more so test it and then turn it on. So it's definitely a unique model, but it's much better than the kind of nickel and diming.
Okay.
I
Yeah,
wanna
I
know,
think we.
Qvera is an interface engine, so it does more than just, like, we can use it for things other than Athena or other than EMR work. So we may have things we're doing with it.
Mike Williams, is he still there?
Yes, I think so.
So I'm gonna go ahead and stop the recording if we're all I think we ended the patient registration and scheduling session, so thank you.